Many residents tell me the same thing. Figuring out how AI fits into our daily clinical and academic practice feels overwhelming. Every week there's something new. Another model, another tool, another risk to understand. And that confusion, it's not just uncomfortable. It changes how safe, efficient, and confident you feel at the bedside. Right now, out of nearly 200 medical schools in the US, only about 20 have any kind of AI curriculum. So it's no surprise residents and students feel unprepared. We're simply not doing enough to help you adapt to this shift in technology. So if you've been feeling overwhelmed, you're not alone. The pressure to keep up is real, but the reasons behind that pressure might surprise you. In the next few minutes, I'll break down the 3 forces driving this challenge and show you what you can do about it. Reason number 1. The pace of AI is unlike anything we've seen before. ChatGPT reached 100 million users in just 2 months. TikTok took 9. Instagram, 2.5 years. That speed isn't just about popularity. It reflects how fast the underlying technology is evolving. Companies are racing to release the next breakthrough, and that constant acceleration is why it can feel like the ground keeps shifting beneath your feet. New claims, new research, new capabilities, all arriving faster than anyone can process. No resident could possibly keep up with it all, and you don't need to. Here's the truth. Trying to master everything only leads to burnout. Instead, pick one tool that actually helps you in your daily work and learn it deeply. You don't have to chase every update. You just need to stay curious. Reason number 2. The stakes in medicine are higher. In our field, every new AI tool touches privacy, bias, and patient trust. And here's the other challenge. AI isn't just chatbots. It's also the algorithms quietly running inside monitors, imaging systems, and clinical alerts. The FDA has already cleared nearly 1,000 AI-based tools. In OB/GYN, AI is already shaping how we prevent complications, detect emergencies earlier, and train residents more efficiently. But the same caution applies when you use large language models. They can hallucinate, creating citations, guidelines, even management plans that sound authoritative but are dangerously wrong. So before using any AI tool for clinical decision support, ask yourself 3 questions. Has this tool been validated in real patients? Do I understand its limitations? Is it designed to support my judgment or replace it? If a tool can't clear those 3 questions, no matter how polished it looks, that's your red flag. And that raises a fair question. Why aren't we getting any training on this? Reason number 3. Medical training hasn't caught up. Most of us don't have a clear roadmap for using AI safely. There's no formal curriculum in medical school, and even less in residency. But why has training fallen so far behind? Because AI is evolving faster than our educational systems can keep up. New tools appear every month. People are learning as they go. And in medicine, the possibilities are everywhere. From diagnostics to documentation to teaching. That makes it both overwhelming and incredibly exciting. But this isn't the first time we've faced a tool that seemed threatening. When calculators appeared, teachers said they'd kill math. When electronic medical records arrived, physicians said they'd kill bedside medicine. When Google launched, experts worried patients would stop listening to doctors. And yet, we adapted. Here's the truth. AI won't replace you, but doctors who use AI may replace doctors who don't. And if you want guidance on that journey, you don't have to do it alone. This is what we do at Pathways OB/GYN. We help residents like you navigate innovations in women's health and learn the skills to use AI safely and effectively. So if you're ready to stay sharp, cut through the noise, and put these tools to work for your patients, follow Pathways OB/GYN. Your future self will thank you.